I'm going to talk about various routes of drug administration. So, for both nursing and UGBBS students, this will come as a short notes. So, please pay attention. We already know that we have different routes of administration, but what is the choice? What makes to choose different routes of administration is very important, right? So, we will know what are all the factors which influencing the factors which influencing the routes of drug administration. Okay, so based on the need, if we need any drug which has to be immediately acting, which needs immediate action, we will go for parenteral routes such as IV, right? And if we want long-term treatment, if we want to take allow the patient to take a tablet for a long time, we can deliver it for long duration, right? So we can go for oral. Then, if you want to give the drug at a particular site, we will go for intramuscular route. And also, whenever you administer the drug, based on two factors, it will get absorbed from that site, that is solubility and ionization. So please remember that whenever the drug is in unionized form, it will get absorbed easily. So whenever there is unionized form, the solubility is high and absorption is high. Okay, please remember that. So, what are all the routes of drug administration? Okay, we already know oral route and intravascular route. There are various other routes also. You can see subcutaneous route, intramuscular, intravenous, intraarterial, ocular, aortic, that is the ear, intranasal, then rectal, vaginal, transdermal patch, and local application. And this means spinal application. Okay. So with this idea, we will go discuss further about various other routes. Okay. As I said, first we'll talk about oral food. Oral food, we all know that it is easy to administer, right? The patient himself we can take it. And it is a most convenient dosage form, easily can be administered. And even though if you administer little large dose of the already drug which is given orally, can be easily deactivated with the help of antidotes such as activated charcoal. So, okay, so oral form is the most general dosage form, self-administered, and if any toxicity happens, we can deactivate by using activated charcoal. Okay, in this oral formulation, there are various other formulations. Okay, like I said, if you want to treat any chronic conditions, you can go for oral drug, right? In that also, there are various formulations. Whenever I talk about oral, few things will come to your mind, right? It has to be taken orally. Once you take, it has to cross various organs. It has to go to the esophagus, then go to the stomach, then it has to survive the gastric juices. Then only it can go to the stream for absorption, right? There are various factors which will inhibit or disturb the oral route. So we have come up with various different types of formulations. Okay, like I said, whenever you want to administer any drug and it has to survive the stomach's acidic environment, we can use entry-coated tablets. Entry-coated tablets are nothing but there's a protective gel or silicone gel over the drug, which protects the drug from stomach acid and it will enter the site of absorption, that is nothing but intestine. Okay. So drugs such as erythromycin, omeprazole can be given in the entry-coated formulation and drugs such as sulfasalazine, which is classically used for inflammatory bowel disease, right? It has to reach the intestine. So these drugs also coated in entry-coated tablets. Okay, guys? Yes. And most important, extended release preparations. We already know various painkillers will come in these extended release preparations. Okay. Why? Because they can be given in good controlled drug release, prolonged duration of action. The onset will be slow, but the duration is prolonged. And also, any drug is short action. Like I said, morphine is a potent painkiller, but it has very short duration. So, it has to be given in extended release, right? And what more advantage? When you give extended release, it will act for longer duration, like I said. Okay. So, the need for frequent dosing comes from. So, we can give either twice daily dosing. Okay. So the need for dosing comes from the action will be for longer duration with any external preparation. Most common example is painkillers. Okay. Yes. Now again in oral we have two other formulation that is sublingual and buccal. Okay. What is sublingual? The drug has to be placed under the tongue. Okay. And in buccal, it has to be placed between cheek and gum. Okay. Main use is ease of administration. The patient can himself keep only the difference between buccal and sublingual is the sublingual route will bypass the first pass metabolism. First pass metabolism is nothing but any oral drug when it is given, it has to go to the liver for its metabolism, then it will get activated or it will deactivated. By the time it will reach the liver and it comes to blood circulation, half of the drug will get eliminated. So any drug which first bypasses the first pass metabolism will have larger bioavailability and it have faster action also. Okay, so any patient who's come with acute MI, you have to treat it fast, right? You have to give a vasoconstrictor. So usually we give nitrates in sublingual fluid. The moment patient keeps it under his tongue, it will bypasses the phosphate metabolism and give immediate vasodilate reaction in the blood vessels of our right. And you can see this C get administered below the tongue. Okay. Similarly, buccal has to be placed between the cheek and gum. Okay. It has rapid absorption. Okay. These are all the advantages of sublingual and buccal routes. Okay. Now, with oral route get completed, we are coming into the next route of administration, that is parenteral. The moment you tell us parenteral route, it cannot be given in oral. Okay. Either it has to be injected to the patients. Now, what is the advantages? Any unconscious patient can easily give parenteral drugs, right? We can directly inject to him, whereas any oral drug cannot be given in unconscious or comatose patient. Okay. Another best advantage is any parenteral routes directly enters the system in circulation and the control is with us. Okay. The guy or a doctor who is injecting the drug or who is instructing the drug easily can titrate the dose, whether you can increase the dose or decrease the dosage, and that you can control the rate of infusion also, and also very fast, rapid onset of action. And as I said, any oral drug, we have to worry about the acidic environment of the stomach, right? So any drug which is unstable in GI or any drug which is poorly absorbed from GI cannot be given orally. We have to go for other parenteral routes. Okay, one of the classic example poorly absorbed drugs from GI is heparin, whereas insulin will get metabolized or destroyed by the gastric juices. Okay, so these are all the drugs which is preferred in case of parenteral. Okay, now we will see various parenteral routes starting from intravenous route, which is given in the vein, intramuscular route, which is given in the muscles, and subcutaneous route, intra-articular route, which is given in the articular space between the joints, intraocular route, intranasal route, intra-aortic is nothing but is given the here, okay? Epidural, spinal, subarachnoid, all these routes are to install the drug in the cerebrospinal fluid, which again brings the drug to CNS for any CNS infections. Okay, let's see different routes of administration, right? Different parenteral routes. First one we are going to discuss is intravenous route. Like I said, when we prefer intravenous route, when the patient is comatose, unconscious, okay, and we want to give the drug fast. So typically in emergency situations and situations where anesthesia is required, okay, and when you to do a proper surgery, we need anesthetic agent and also a skeletal muscle relaxant agent, right? So drugs like Furadine, Bacfuradine, Vecfuradine, Attracturium, all are skeletal muscle relaxant given in IV room. Okay. And the same can be given during the time of intubation also. Okay. Why we prefer intravenous route? Rapid action. Okay. After all the parenteral route, we can maximum and rapid action with intravenous. Okay. Similarly, maximum control also. We can easily titrate the dose and we can give minimum dose or dose. Okay. So maximum control also can associated with intravenous route. Okay. So speaking of intravenous route, we have two types which we can administer the drugs. Okay. One is bolus, another one is infusion. Bolus is nothing, just to take the dose, full dose, give at a time. Whereas infusion is nothing but we can titrate the dose which has to be given particular unit of time. Okay. A classical example goes for insulin, digoxin, all life-saving relief fluids can be given infusion. Okay. Rest adrenaline has to be given as a bolus once in the shot. Okay. So what is the main advantage of infusion? It has low peak plasma concentration and it can be increased duration of circulation within the body. Okay. With bolus, we will get increased plasma consumption at particular time, but the duration of action of the drug is short, whereas with infusion, there will be less peak plasma concentration initially, but the duration of drug will be long because it can be titrated for longer duration. Okay, guys. Yes. Now we'll go to the next parenteral route of administration, that is intramuscular. Okay, it is most commonly we can see many patients with fever who come for injection, right? Which actually right there you can take paracetamol and you can choose. Okay, so another second most rapid absorption route is intramuscular. Okay, and here we have two formulations. One is aqueous solution, another one is the solution of polyethylene glycol. Okay, why there is need for two different solution of which place? Whenever it's made in the aqueous solution, it can be directly injected into the intramuscular area. From there, it will get absorbed. Whereas, if we need it for longer duration of action, right? If you want the drug for staying in the body for a longer duration, such as oral contraceptives, any lady who want to bypass the pregnancy or postpone the pregnancy, there were contraceptive pills, right? But oral contraceptive pills again have they have to take it right time. They will forget. If they forget, they have to follow another cycle. So what they will do? They will implant the contraceptive in the body. Okay. So when you make the drug as an implant, what is the importance? It has to be it has to be made in a polyethylene glycol gel manner. Okay, it has to be made in a polyethylene glycol base, and it has to be placed in a particular part of the body. It can be injected into the body. Okay, so it is considered as a teapot. So specialized in import with the polyethylene glycol base will be injected or implanted in the body. Okay, so from the implant side, it will get precipitated. Okay, it will get precipitated and it will get released. So the absorption will be slow because it has to get precipitated out, it has to be absorbed, then it will go for site of action. Okay, so it is relatively having longer duration of action and slow absorption. Okay, then other routes of parent routes of administration, such as subcutaneous administration, intradermal administration. Okay, subcutaneous route is the drugs act by simple diffusion. Okay, once you inject in the subcutaneous area, the drug will passively diffuse from that area and it will go to site of action. Okay, just like default injection is also having slower absorption and slower onset of action. Okay, if it is, we can give constant and slow sustained action of the drug. Okay, drugs like insulin, the patient has to take for long-acting insulin, short-acting insulin, right? If the patient has to take a long-acting insulin, it has to act for longer duration and have a sustained effect, right? So we'll go for subcutaneous injection. Okay, the same insulin, if it is given in the intravenous route, it will act pretty fast because beyond that, intravenous route has the rapid absorption, whereas subcutaneous would have simple diffusion, slow absorption, I would have steady and sustained effect. Okay, so when we should stop subcutaneous injection, or what is the problem with subcutaneous injection is whenever a patient having tissue irritation, stop subcutaneous infection. If there is a severe pain, stop it. Necrosis of injected area, stop or change the treatment. Okay. And intradermal. Intradermal nothing but we will inject the drug in the vascular layer which is below the epidermis, that is dermis. Okay. So few times only we get the intradermal, which is specially for any diagnostic test or deep sensitization procedures. That time only we'll go for intradermal. And now we go talk about rectal route. Rectal route have another classical benefit, that is it also bypasses phospholipid, right? We already discussed, right? Any drug which bypasses phospholipid will have faster onset of action like that of intravenous routes. So any unconscious patient, any comatose patient, any dehydrated patients where it is difficult to find the intravenous line can go for rectal. Okay, and in children, with severe febrile seizures, difficult to find the intravenous line there. Again, we can go for rectal paracetamol. So, rectal wound with the benefit of phospholipid has a better chance of reaching the site of action. Okay, so the route is preferred for patient who are comatose, unconscious, not able to take the drug orally, and if the drug is very nauseating, if the drug is having metallic taste, again we can go for rectal route. Okay, then all other routes which is presented here in the nutshell. Okay, epidural spinal roots, where drugs have, we already know that CNS have something called blood-brain barrier. Okay, our CNS have blood-brain barrier. So just like that, any drugs we cannot process. So if at all you want to administer any local drugs over there, if at all any the localized infections such as meningitis, which is present there, we have to do that drug in the spinal area. We have to give in the epidural area. We have to give in the subcarotenoid region so that the drug will enter into CSF. From there, it will go into the concerned area of CNS. Okay. Similarly, any local infection of eye can be droplet drugs, just moxifloxacin, which present eye drops, right? Intra-aortic infections, any fungal infections in the ear, okay, any local infections in the ear, we can give ear drops. Okay, intra-articular injections. Patients with severe knee pain, severe arthritis, irresponsible for any oral drug, not responding to the oral drug. We can give the steroids directly in the intra-articular space, right? Similarly, intravaginal, intrarectal. So wherever there is localized infection, we can give those drugs, right? Okay. And if the patient is having severe asthma, so its pulmonary epithelium is very, very sensitive to allergens. Okay. So instead of giving IM, we can go for intranasal routes. So intranasal routes again has the benefit of bypassing first pass metabolism. Okay. It will also bypasses first pass metabolism. Rarely lung will act as a metabolizing organ there, but also reaches the area where needed fast. Okay. So these and when it comes to intranasal route, the drug will be given in aerosol or anesthetic forms and it will reach the pulmonary epithelium. Okay. If a patient is having asthmatic, you can do intranasal route. Similarly, whenever surgery is done, patients has to give an inhalation anesthetic agent, right? So again, we prefer intranasal route because it reaches the site of action first. Okay. And transdermal patch, it absorption varies with the skin conditions. If the patient is having intact skin, the absorption is less. If the patient is having deranged skin, the absorption will be fast. Okay, so based on the physical characteristics of the skin, the uh, absorption will be very, very fast. Okay, and if the patient wants longer duration of action, we can go for transdermal patch. Okay, because they have longer duration of action. Unless you take out the patch from the body, it can stay there and effective to them. Okay, and easy to administer, it is safe administration. Okay, now what are the problem with these different routes of administration? Any oral drug will have GI side effects, nausea, vomiting, diarrhea. Okay, because it is crossing so many organs, the other organs, stomach surface, is over there, everything. Okay, and intravenous fluid has the disadvantage of thrombophlebitis. Okay, if any person who is unskilled person trying to give intravenous fluid, the chance of extravasation to the nerve tissues were prolonged usage of the same vein for injection or steroids. Okay, similarly, intramuscular fluid have the chances of abscess formation if it is given without any aseptic precautions. Okay, similarly, any CMS routes such as spinal, epidural, intra-arterial injection, all must be done with utmost caution because any septic infection introduced into the CMS or the knee joint, which will have severe adverse effect and severe infections. Okay, and when it comes to rectal route, sometimes it may be erratic and incomplete absorption that came from the site. Okay, yes. With this, I conclude the topic of different routes of administration. In this topic, we have discussed what are all the different routes available, starting from oral and through rectal route. Okay, thank you guys. See you in the next video.